Hello, Dr. Crentist. My name is Stephen. I was hoping you could help me. You see, I retired this month to Florida, and I used to be a professional dancer. But I've had this pain in my teeth. It hurts so badly when I eat or drink hot liquids. It's even gotten to the point that I can't do my dance moves anymore. See? I almost fell down because of the pain.
Well, I am glad you came. What you have is dentine hypersensitivity, a sensation felt when the nerves inside the dentin of the teeth are exposed to the environment. Dentin contains many thousands of microscopic tubular structures that radiate outwards from the pulp. Changes in the flow of fluid in the tubules can trigger mechanoreceptors present on nerves located at the pulpule, thereby eliciting a pain response. This hydrodynamic flow can be increased by cold, air pressure, or forces acting onto the tooth.
So what's the game plan, Doc?
Well, I can see from your chart that you have gingival recession and erosion on your canines and first premolars. This is the likely reason for your exposed dentin. The American Dental Association does not specify a particular treatment for either gingival recession or erosion under the list of practice parameters. They do make a point of saying that these signs are multifactorial and recommends that the dentist determine the underlying etiologies and treat accordingly. For instance, the American Dental Association mentioned that erosion can be due to diet, smoke less tobacco, or bulimia, and that the dentist must address these issues.
While it is a great way to lose a couple of pounds before bingo night at the senior center, I do not have bulimia. I do, however, love Diet Coke.
Ha.
Okay, well, what should I do? I've been experiencing this pain for 6 to 8 weeks, and I cry myself to sleep at night because of the pain. I read on Wikipedia that there are multiple ways to treat the pain. Have you heard of Sensodyne toothpaste?
Ah? Why, yes, I have. Potassium nitrate is a dentifrice often prescribed to treat dentin hypersensitivity.
Does it work?
It's difficult to definitively say so, but allow me to share with you my vast knowledge about the subject through 3 publications. Would you like to take a seat?
No, that's okay. I am allergic to chairs anyway. Please continue to describe whether or not I should be using Sensodyne or other potassium nitrate-containing products.
Very well. In 1994, a gentleman by the name of McGaw conducted a double-blind study to test the effectiveness of toothpastes that contain 5% potassium nitrate, which is quite similar to Sensodyne. The study basically showed a complete relief in 67% of the patients and a reduction in symptoms in 80%.
Oh goody. So you're saying I should use Sensodyne?
Keep your pants on, slick. This study had some issues that you should be aware of. Namely, it lacks external validity as it examined a limited number of younger Japanese individuals and tested pain on a subjective scale.
What? Do the Japanese have different teeth or something? And what do you mean younger? I'm only 65. My wife doesn't think I'm old.
Funny. Anyway, there was also a decrease in sensitivity from baseline observed in about 24% of the control group and a complete reduction in symptoms in 6%. This may be due to the Hawthorne effect or the placebo effect. In terms of internal validity, the article did not specify how the subjects were assigned to either the control or experimental group.
Okay. So what are you saying?
I am saying that unless you are Japanese and 20 years younger, the results may not be indicative of a solution for your particular case given the circumstances of the study and differences in population.
Well, doctor, between my chair allergy and your British accent, I am getting tired. Could you please tell me about studies that would apply to my case? Bingo starts in 2 hours.
Well, certainly, my cheeky chum. The next study we shall discuss was conducted by Silverman. This study was also a randomized controlled trial performed here in the United States. Patients with dentin hypersensitivity, similar to your case. Yet again, 5% potassium nitrate was tested against a placebo, but this time the testers utilized pastes with and without fluoride plus a strontium-containing toothpaste. This study actually showed that the toothpaste containing only potassium nitrate had the greatest reduction in Dentine hypersensitivity at 35%, which are indeed promising results and significantly superior to non-potassium nitrate containing products.
That sounds perfect. Where's my prescription, Doc?
Settle down, silly face. As I said, promising, but certainly not perfect. That study only tested adults 18 years and older, most of them females and Caucasians. You see, my dear chum, based on the inclusion criteria, this may not be applicable to you. Additionally, the subjective measurements of pain were based on patients' recall experience between examinations, predisposing the measure to recall bias. Moreover, the authors observed a placebo effect.
Okay, Doc. This is getting ridiculous. You still haven't told me whether or not Sensodyne works. You'd think that someone would have perused through all of these different studies by now to come to an ultimate conclusion.
Well, my good chap, it just so happens that someone has done this. It's called a meta-analysis performed by the Cochrane Collaboration, who create systematic reviews of primary research in human health care.
Finally.
This study analyzed studies on the effectiveness of potassium nitrate containing products, like Sensodyne as you mentioned. The prior two studies we discussed were also reviewed in this analysis.
Somehow I feel like you're going to tell me that this study won't help me find a solution to the efficacy of potassium-containing dentifrices. I think I am going to cry. I can't eat the foods I love, and my dance career is over. Do you have any Kleenex?
No, you crybaby, but let me offer you some perspective. Indeed, though each of the clinical thermal tests may have independently shown that potassium nitrate-containing toothpastes causes a reduction in sensitivity, it also expresses that the subjective assessments from patients failed to show appreciable decreases in their sensitivity. Additionally, this article demonstrated that sufficient studies have not been conducted to definitively say with enough clinical evidence that potassium nitrate-containing toothpastes decrease hypersensitivity. My personal criticism of this review is that it only analyzed trials of 8 to 12 weeks and attempted to integrate data on pain into one format. Please understand that pain and sensitivity is an intrinsically difficult measure to ascertain. If I hit you and another person in the face with a hammer at the same velocity, how would I ascertain differences in pain between the two of you?
Oh, I see how this could prove to be difficult in the study. I never thought about it that way.
Precisely. This is what needs to be done in terms of research that will definitely help patients like you in the future. Specifically, baseline and inclusion criteria for study candidates should be more clear. Scales of pain assessment need to be standardized in a consistent way, and a wider spectrum of patients, specifically older ones like yourself, should be included and categorized accordingly.
Yes, that would have saved the 6.4 minutes of you explaining all of this.
Here's what we'll do. I will prescribe Sensodyne toothpaste for you to use. You must judiciously use it and be compliant with the instructions provided. It is likely that you will experience some relief, though based on the research I've provided you, I cannot guarantee it as there is more work left to be done in this field.
Well, I am going to go try this out to see if it can bring back my dance moves.
May I join you?
Why, certainly.
My mind, through spectral lights I see you. When I arrive, the dance floor comes alive. The pulse takes to my mind.